Radiographic techniques in bone assessment and spinal imaging. Understanding bone age, bone survey, arthrography, long bone measurement, myelography, and scoliosis imaging. By J.C. Locklear and Chelsea Wilkes. Overview of imaging modalities in bone and spinal assessment. Importance of diagnosing and managing orthopedic and systemic conditions. Role of radiography in skeletal development, joint function, and spinal abnormalities. A bone age study is a radiographic examination to determine skeletal maturity. Bone age studies may be done for a variety of reasons, including forensic and pathological purposes, and to determine future growth potential. Examples of pathological conditions include malnutrition, endocrine disorders, and non-endocrine disorders. The most common image elevated is a single PA of the left hand and wrist. However, the knee, foot, and ankle, fibula, and hemiskeleton, radiographs of half the skeleton, have also been used. Protocols may differ based on a radiologist's or pediatrician's preference, and technologists should be familiar with the routines specific to their facility. Ossification in the hand and wrist follows a predictable pattern. At birth, the metacarpals, phalanges, radius, and ulna are visible on x-rays. By 3 to 14 months, the capitate and hamate begin to ossify, followed by the epiphysis of the phalanges, metacarpals, and distal radius between 14 months to 3 years. From 3 to 9 years, the epiphyses widens and additional carpal bones appear. Between 9 to 14 years of age, the epiphyses extend toward the metaphysics, with the pisiform and sesamoid bones becoming visible. After 14 years, the epiphyses narrow and fuse with the metaphysis, completing development. A bone survey is a series of radiographs used to evaluate the entire skeleton for various conditions, including systemic bone disease, trauma, and suspected child abuse. Commonly used to detect conditions such as osteoporosis, Paget's disease, and multiple myeloma. Crucial for assessing fractures in pediatric patients, diagnosing metabolic bone disease, and bone metastasis from cancers. It typically includes multiple views such as skull, spine, pelvis, long bones, and hands/feet. The technologist should obtain the best images possible while maintains the Alera principle owing to the number of exposures required. A method that is not acceptable is a technique known as the babygram. Alternative imaging modalities include CT, MRI, sonography, and nuclear medicine. Rib fractures, especially multiple and posterior, are a strong indicator of child abuse. Arthrography. Purpose: examines internal joint structures and detects issues like tears and injuries. Common joints: shoulder, knee, hip, wrist, elbow, and ankle. Techniques: X-rays such as fluoroscopy, CT, or MRI, orography. Indications: joint pain, injury, and chronic conditions, e.g. osteoarthritis. Procedure: contrast injection into the joint, followed by imaging. Risks: infection, allergic reactions, joint damage, discomfort. Benefits: detailed joint evaluation, early diagnosis, and non-surgical assessment. Long bone measurement. The hip to ankle study is being more commonly performed in radiology department as a way for orthopedic physicians to assess the lower extremities bilaterally. The purpose of this exam is to obtain accurate measurement of leg length discrepancies. It is common in pediatric orthopedic emulations and post-surgical follow-ups. Techniques include orthoangiography, which uses 3 AP X-rays, hip, knee, and ankle. Scanogram, which is similar to orthoangiography, but uses a single exposure with metal markers, and EOS imaging, which is low dose, 3D assessment of spinal and limb alignment. Clinical indications include congenital limb length discrepancies, post-traumatic limb shortening, and pre- and post-operative evaluation for limb lengthening surgeries. A myelogram is a radiographic study of the spinal cord and its nerve root branches that uses a contrast medium. The contrast medium is injected into the subarachnoid space. Clinical indications include herniated nucleus pulposus, which is the most common indication, cancerous or begin tumors, cyst, and in trauma cases, possible bone fragments. Contraindications include blood in the CSF, arachnoiditis, increased intracranial pressure, and a recent lumbar puncture within 2 weeks. Generally, a range of 9 to 15 milliliters is used. Puncture sites usually include 2 locations: lumbar, L3, L4, and cervical, C1, C2. For lumbar, the patient may be prone or a left lateral. For a cisternal puncture, the patient may be seated in an erect position or prone with a rad flex to open the inner spinous space. The conventional myelography routine has been largely replaced by the imaging modalities of CT and MRI. However, conventional or fluoroscopic imaging may be used in conjunction with CT. Scoliosis is an abnormal curvature of the spine, often forming an S or C shape. It can be classified into types such as idiopathic, congenital, and neuromuscular. Radiographic imaging, including AP and lateral x-rays, as well as full spine and bending x-rays, is essential for diagnosing and assessing the curvature. Treatment depends on the severity, with observation for mild cases, bracing for moderate curves, and surgery for severe cases. Early detection is vital to prevent complications such as lung and heart problems in severe cases. Understanding these radiographic techniques allows us to effectively diagnose and manage musculoskeletal conditions. Whether assessing bone age, conducting a bone survey, performing arthrography, measuring long bones, utilizing myelography, or evaluating scoliosis, each imaging modality plays a vital role in patient care.